Looks like we are live. Hi, everybody. If you're joining us now, thanks for your patience. We had a little bit of technical difficulty. I guess when we are trying to update our profession on healthcare that's also in a state of evolving, we are too evolving our patients and dealing with technology. So we apologize for the late start, but if you're joining us or patched in, thank you for being your patience. I'm Brian Jones with the NACVA CTI, and we'll get right to it. Joining us for this month's YouTube Live are Todd Zigrang and Jessica Bailey, both of them with Health Capital Consultants, headquartered in St. Louis, Missouri. We have been working with Health Capital Consultants to build a interactive, online, advanced healthcare valuation course. And this conversation is designed to talk about that and the industry. Todd, Jess, hi, thanks for joining us today.
Good afternoon.
Thank you for having us.
Yeah, and thanks for hanging in with the technical difficulties. So let's dive right into the topic here. Healthcare valuation. Health Capital Consultants certainly has been at the forefront of training and continuing education for over 2 decades, actually. Tell us a little about the firm and your mission and focus on providing education and training in this consulting niche.
Yeah, thanks, Brian. Health Capital Consultants, we're now in our 25th year of operations. We're a national healthcare valuation and economic and financial consulting firm founded by Bob Pasin, who passed last year. Certainly a pioneer when it comes to healthcare valuation, a mentor, a friend. The outpouring since his death has been overwhelming, especially hearing from others his generosity throughout the years. It really means a lot to me and the firm here, and that's something that we want to carry on here at Health Capital Consultants. Health Capital, we started again 25 years ago. Bob was employed by a large national recruiting firm in the Northeast. He was the medical practice valuation arm, literally the one person of that function. And there wasn't a lot of literature writing out as far as business evaluation. There were certainly the writings of Shannon Pratt, Ray Miles, and others who really made business evaluation a profession by memorialized methodology, defining what general accepted methodology is when it comes to business evaluation. And Bob tried to apply that to the healthcare industry. He wanted to further the profession by speaking at trade associations, similar to another 20, 25 years ago, and didn't get the support from his employer, who didn't see the value in teaching others and sharing with others, especially competition, how to appraise medical practices and other healthcare enterprises. And so with that impasse of ideology, Bob bought the desk, the chair, the computer, all singular, changed the name on the door from that organization to Health Capital Consultants back in October of 1993, and here we are. And I think that's certainly been the foundation of what we've been about, and his core belief, and that's when it comes to research and financial and economic research and library. We dedicate a large portion of our staff, our salary, our resources to research, and that's the core of all of our services. We don't liken ourselves to an evaluation firm. We're more of a research house in which valuation and other opinions that we provide is a method in which you're able to keep the staff in pizza and overhead, if you will. But we've been built on giving back to others, and that's certainly what Bob is wanted to leave more than anything else is not wealth, but more giving back to, adding to the profession, giving back to and repaying others that's been so gracious to him throughout the years. Our office is scattered with Bob and others that's gone before him, and been generous to him, and that's certainly what he wanted to do with others. And this program is just I think a large way in Bob's feather in his cap as far as what he wants to leave the profession.
Bob certainly, as you indicated, has left quite a legacy on our profession. In my housekeeping list, and I came across our very first webinar schedule in 2007. NACVA and the CTI pioneered in our profession by launching webinars, live webinars. In fact, Bob Pasin presented our second webinar in May, on May 3rd, the valuation of healthcare ancillary services, ambulatory service centers, specialized hospitals, diagnostic imaging centers, outpatient cancer treatment centers, and dialysis facilities. In 2007, and throughout that year, he presented over a dozen other topics. So you all are certainly picking up on his legacy and carrying it forward and continuing since 2007 to providing this training to our profession. So how did you both get to this point in your career?
Well, I started with Bob in Health Capital back in '95. My training and background was in healthcare delivery, hospital administration, medical practice administration. And I started with Bob, again, back in early 1995. And I had that background, especially with healthcare finance and looking at what the service delivery within Health Capital Consultants. I got my hands on everything I could read about valuation. Again, the books by Shannon Pratt, the books published by PPC, PCH, Ray Miles, Chris Mercer, Jim Unland, all those that I did get my hands on and learning about valuation, the fundamentals, the approaches, the methodologies, the basic economic tenets that are involved with the valuation of healthcare businesses. And from there, I've been here for now 23 years and seen healthcare go full circle, and I've seen a lot. And I won't blame it on the four daughters, but I think healthcare has aged me more than that. So.
And then for me, I went to law school and graduated from St. Louis University with my degree in law and concentrated in health law. So I knew I wanted to work in consulting and luckily found Health Capital because I was in town. And I've worked primarily kind of where Todd started out on the research side, and I've stayed there, really working now, project managing the research side of our projects, making sure that our analysts are smart in what they're valuing, because kind of as we'll talk about with this course, you really can't value anything in healthcare unless you really have a good background and knowledge of what has happened, what's happening now, and what we're anticipating happening in the future.
Yes.
Great. So both of you spent most of your, oh, sorry, go ahead, Todd.
No, I was thankful that she found us.
Okay. So both of you have spent most of your careers, but even prior to your studies and education relating to healthcare in this industry. So why do you feel this kind of training is important?
Well, healthcare is approaching 20% of our economy. I think it's a large part of the transactional activity that we see out in the marketplace. And healthcare valuation is different than valuation of a lot of the other industries. Certainly that we have the regulatory scrutiny that's involved in healthcare that we don't see in a lot of the other industries. Specifically, you can't, my inbox is inundated weekly with hospitals and healthcare systems getting fined by the government, whether it be the HHS, Office of Inspector General, the Department of Justice. Majority of our clients are tax-exempt organizations, so the IRS certainly has an interest in the types of transactions that they're getting involved with, whereby they're settling cases where there might be fraud, abuse, star, canine kickback claims. So, and it all points to fair market value and commercial reasoning. It's the thing that we get engaged to look out for on behalf of our clients and advise them and guide them. So our clients are really counting on us to understand that and do our work in accordance with, again, the background in healthcare and where things have gone and are going in the future. And so we're in that being while working for our clients, being independent with our work and bringing that to the table. And so I think that's what this course is all about, is arming us out there to to be able to pick out in this whole universe now the thing, I mentioned a few publications that I read early on in my career that's what was out there. But since then, there's a whole ocean of available information out there as far as valuation in healthcare. And it's easily be overwhelmed. And I'm thankful to have a staff like Jess and her team to help disseminate that information and be able to condense it for us and so we can communicate it, dissect it rapidly, because we have to be time efficient with our work and certainly be able to communicate that in a way that our clients understand. And I think that's what the background of this case in this program is, not only answering questions, but arming other appraisers what questions to ask, what to know from that whole, again, ocean of information that's out there that's passing us by with the advent of the internet, and certainly as the canon of professional literature.
So how is the program structured?
So the entire program itself will be comprised of 10 courses, 8 of which participants will all take. They'll be core courses, and then 2 of those will be elective. So if those participants have more of an interest in inpatient enterprises like hospitals or outpatient enterprises, they'll be able to tailor that a little bit. So each of those courses will be about 4 hours. So it'll be broken up into approximately 6 modules for each course. And of course, with it being distance learning, participants can stop it, start it, come back to it as they please. The only caveat being that there will be knowledge checks throughout, and then a quiz at the end of each course. At the end of that, there'll be a capstone project upon which, if everything's completed, they will earn a CEA, we're calling it, a Certificate of Educational Achievement.
And then there's 6 core courses that are required. Then there's certainly electives based upon the interest of the individual taking the course. And the core are based upon valuation tenets, that's being one of them. And then we'll really drive into what we call the 4 pillars of healthcare evaluation. And it's, we liken it to growing up and going through management courses. There was SWOT analysis or Porter's 5 courses. And we saw this 4-pillar concept as something that we could really grasp on and guide us in healthcare evaluation. So those 4 pillars being regulatory, which we touched upon earlier, reimbursement, certainly how healthcare is bought and sold and how it's paid for is much different than a lot of other industries, and especially even within subsectors within the healthcare industries. We see payer consolidation is a large portion of that, and how one unit of healthcare is being paid for and sold, especially as we see healthcare being homogenized and protocolized, so it can be bought and sold in the marketplace. I think reimbursement really plays a big portion of how the value drivers in healthcare. The 3rd pillar would be competition, and we're not talking about the hospital next door, the physician practice next door, but we're talking about, again, Michael Porter's 5 forces of competition, how healthcare is being delivered, and we certainly see not in your traditional places such as hospitals, medical practices. Now we're seeing it at Walmart and Target and other delivery places in different providers of healthcare services. There's certainly the corporatization of medicine that are coming into play. It's going back to Wall Street and private equity, how it's being capitalized. So certainly that's a 3rd pillar that we're looking at is the competition, and the 4th being technology. And when I think of healthcare technology, I always think about the cool beams and X-rays and things that diagnose care, and that certainly plays a part of it. But we're also talking about electronic medical records and health records, talking about processes and protocols, telehealth. I mean, that's playing a huge part of that. So certainly technology has an impact, and certainly can create other avenues and processes in which healthcare is delivered. So making sure that everyone who takes this course are aware of those and ask those questions when taking on a healthcare evaluation engagement.
So the course will center around the 4 pillars of healthcare evaluation, those being the regulatory environment, reimbursement, competition, technology. talk a bit about the team that has helped you assemble the outline, the syllabus, all the different knowledge points. Certainly from these 4 pillars, there's very specific content and analysis that's required in doing this valuation. Why were these 4 pillars critical to this course, and maybe a little bit about some of the other individuals who've helped contribute to the outline and the syllabus?
Well, again, the four pillars was a concept in which Bob developed. I think, that with everything in healthcare evaluations can be condensed within those 4 categories. As far as those who's helped us, we've employed a number of people within Health Capital on our team that we're very thankful for their time and efforts towards that end. Certainly, we spend a lot of time reviewing case law and how regulations have changed over time and what's legally permissible. We've counted on a large client participation as well. Over 25 years, we worked with the top health care minds in the country, as well as the largest healthcare systems and smallest, that all contributed into the program in which we developed all of our educational background, and how we can see how that fits into healthcare, and how we can, again, from this ocean of information that's out there, we disseminate it and put it into these 4 categories and try to pull out what to focus on when taking on evaluation engagement. So there's a lot of people to thank, whether they know it or not, that have contributed to this course.
Absolutely. And it's been helpful from the client side, because we get different perspectives, where it's the outside legal counsel for a hospital or healthcare system, whether it's the healthcare system's C-suite executives, whether we're talking with government regulators. We get all different perspectives by talking with them, about the same issue sometimes. So being able to see where all kind of the players in the field are looking, what they're focusing on, I think gives us a great perspective that we've tried to put into this course, and focus it on the ultimate audience for us as valuation professionals, who those reports are ultimately written for.
And it's not just Health Capital as far as valuation firms are involved. Over 23 years, I've worked with a number of other healthcare evaluation professionals whose opinions that I agree with or may disagree with, but certainly have provided value and input to this. As appraisers, all we have to sell is our opinion, and sometimes our opinions differ. Doesn't make one right or the other, but especially we take that into consideration when doing our work, and certainly have taken that into consideration with the development of this course. And so we're not the only ones that will be teaching it. There'll be others out that are great appraisers in healthcare and have experience that are unmatched. So I appreciate their input in this.
So how will this course help legal professionals, healthcare executives, and valuation analysts in their everyday work?
Sure, great question. I think for legal professionals, it will help them understand the valuation process and the items that the evaluators are looking for, because ultimately those valuation opinions are typically wrapped up into the legal certification for a transaction. So they are relying on us as evaluation professionals to say, yes, this is fair market value, and here is why, so that they can kind of put their stamp of approval on the transaction and protect their clients. So making sure that they understand the process that we go through and the questions we're looking to ask can certainly help them, I think, as well, in interacting with valuation firms and being able to know what questions to ask when they're reviewing a valuation report.
I participated in a presentation roundtable with a group, and it's really a team process with all these transactions, where it certainly involves outside legal counsel, internal legal counsel, the C-suite executives, the development team that puts the transaction together, as well as the appraiser. Certainly all works together and has to work as a team, and certainly that's what I think part of this course will call out and see the different roles and responsibilities, tasks of each.
Absolutely. And for the C-suite executives or the healthcare professionals that are kind of the boots on the ground every day, I think it helps them, especially in their recruiting and their business development activities, because I think we've seen over the years, people coming to us, but it might be too late. They've already offered a deal to physicians that they can't take back, or, maybe they wouldn't have run into that had they had the knowledge in the first place of, kind of the pitfalls to look out for and those hurdles that they're going to have to jump to ensure any deal that they come to with a physician group or another hospital is going to be legally permissible.
So there's a textbook that will accompany the curriculum that's built into the online module. Talk a bit about that textbook.
Healthcare Valuation was published by Wiley several years ago. That really is a culmination of Bob's 20 plus years healthcare valuation. I think we've taken a lot from that experience, and I'm blessed to have helped him write that, but that certainly is what he wanted to leave the profession. I think in all of Bob's presentations, since you've mentioned a few in 2007, but there are many more before that, he always wanted to leave the attendees or those who participated in those, whether it be a webinar, a presentation, or even reading an article, things to hold on to, things to take home with. And I mentioned a few texts that I read. There's a guide to business valuation, a guide to this, and that's what he really wanted this textbook to be, is a reference, a go-to. So for healthcare professionals, that whenever they take on an assignment, there's a lot of factoids, a lot of bibliographies, a lot of glossaries. It wasn't a whole lot of reading, but things, bite-sized pieces, and so that they could get a hold of, find easily what they're looking for, and take with them a resource that they can apply to their specific engagement. And I think that's really what this textbook is about. It's a 2-volume set, and we appreciate it in the feedback we've gotten from those who purchased it or that have read it. It's quite a task to take on to read.
Yeah. It certainly has been.
About this course being it's on demand and they can take it as they go along.
Right.
That's what this book is about. It's able to dissect in small doses as opposed to some novel that you take on that you just can't put down. This allows people to take on as they have the time to do so. Because when we're talking about, we're all professionals here, and busy workload, and especially with what we talk about, client expectations now are higher than ever. We're bound to our cell phones and emails. Even this Memorial Day weekend, I'm sure all of us were working in one form or another. And in the days, I don't even know if we have a fax machine anymore. But I was, there sitting by a fax machine on the phone. I sent it 10 minutes ago. It's coming, or dialing up and hearing that. That AOL ringing, connecting is still in my brain. But instantaneous access to us as professionals and to our clients as we need it, when needed. I think that's what this book's about. That's what this course is about. And I think this is really applicable to busy professionals.
For those of you who are watching, we certainly are excited as an organization, NACVA, to start moving a lot of our expanded workshops to an online self-guided course, all compliant with the CPE requirements for the North American State Boards of Accountancy, NASBA. So by buying the course, you'll be able to log into a learning management system, an online module where you can work through all of the courses as Jess and Todd have discussed, also receiving the textbook as accompanying material. In addition to that, you will be able to have interactive chat with the instructor team and other experts to answer your questions. There will be case studies and examples and exercises. On this billboard behind me, you will see nacva.com/healthcare. And on the page, if you scroll to the bottom of the website, you'll see a dialog box where you can enter your contact information so you can keep up to date as to when we release the course and special promotions that'll be available once we do. Our intent is to release the course this summer. Todd and Jess and our team here at NACVA have been working diligently to build it in an online module, and we're getting closer, not quite there, but we certainly believe this summer, July, August timeframe, we will have the course available and we'll launch it. So if you want to stay up to date on the launch and other related training in healthcare evaluation, just simply fill out that info box, give us your details, and we'll keep you in the loop. Jess and Todd, talk to us a little bit about the Institute for Healthcare Valuation, which is co-sponsoring this training with NACVA and Health Capital Consultants.
Sure. So Health Capital developed the Institute for Healthcare Valuation, what we call IHV, a number of years ago as kind of the education arm or the training arm. As we kind of first started conceptualizing this course using the healthcare valuation textbook, we saw a way where, you know, with the industry specialization that's happening and all of our colleagues asking us questions, people in our firm asking questions, trying to figure out how we can best relay information and make it easy to digest and, you know, something that they can really take with them and refer back to. So the IHV will be the co-host of this program along with the NACVA and CTI. So, so that'll kind of be the ultimate, I guess, education arm for Health Capital going forward.
And it also allows us to have others participate and provide input, other valuation professionals with the experience and the background that I think that we're going to rely on to move this course going forward.
So are there any other talking points or highlights of this course that we haven't covered quite yet?
Well, I think that the biggest thing that we're going to try to offer is to give another perspective, a deeper perspective with healthcare evaluation. You know, healthcare is different. The appraisal of enterprises, assets, and services has certainly changed over the 23 years that I've been here. You know, as you mentioned earlier, we're sitting in Missouri, and our favorite son here. We're not talking about the past governor who resigned yesterday, Governor Crichton. So we're talking about President Truman, who once said that the only history you don't know is what you haven't lived in the past. So, you know, we've gone full circle. When I started with Health Capital, gosh, 23 years ago, it really was getting into for-profit medicine, where we saw that Wall Street was getting involved and acquiring physician practices. We saw the employment model starting back in the early to mid 90s. We saw that disintegrate in the 2000s, and now we're seeing that consolidation once again. So it's gone full circle, and seeing that full circle, I think allows us the opportunity to take that into consideration in the development of this course. Again, healthcare is different. There's different market economics. There's price inelasticity. There is supply-driven demand that we don't see in other industries, and we're no longer seeing the valuation of medical practices or entirety of an enterprise. We're now seeing discrete property interests, whether it be specific assets, service lines of a business enterprise, leases. So, you know, I think that's what we can bring to the table with this course, and looking at that as we've seen healthcare move to provider-based reimbursement and how delivery is being changed, how it's being paid for being changed, therefore how we appraise healthcare has to change. And that's what I think this course certainly will bring that perspective.
Great.
And certainly this setup allows us to keep updating it, I think, going forward, because healthcare is extremely political, as we all know. So, you know, it can change by the day, by the month, by the year. So being able to keep up on all of that kind of fast-moving change of pace is just as important as getting that background knowledge. So, because, yeah, doing all the background knowledge only gets you to today, and then it's all probably different. So I think this forum really allows us to be able to do that. And, you know, we're so thankful to be able to have you, Brian, and all of NACVA partnering with us. You guys have been great, really listened to your members and you know, try to fit in their expectations, their desires, and provide a lot of value. And we're so glad that this has been able to work out.
Great. Well, we certainly appreciate the time and effort the two of you put into this. Certainly, Bob, prior to passing, all the energy and effort that's been put into this course. It's so nice to see his photograph behind the two of you, still present in our lives and impacting and shaping the way we are carrying out his mission. And so it's nice to see him even as part of this broadcast. For those of you who are online, again, if you want more information about this course at nacva.com/healthcare, you can include or provide your contact information. We'll keep you up to date. In fact, if you do, we'll offer you some free webinars, 2 free webinars actually. So if you leave us your information, our team here at NACVA will reach out to you and offer you some ability to take advantage of some online training. Todd and Jess, thank you so much for your time today and all the energy and efforts you put into helping us build this course. And for those of you who are watching online, we also appreciate your time in joining us and hanging in with the technical difficulties. Any last comments, Todd, Jess?
No, again, I echo Jessica's comments. It's been a pleasure working with you and your team, and the support that's been given to us, as well as the rest of the membership. I think while we've worked with others in the past, I think the support is appreciated, and the momentum that we're seeing is great, and the involvement we're getting from others in the profession certainly can only enhance the product that we're going to be able to share with the membership.
Great. All right. Well, thanks both of you, and thanks everyone for joining us, and we'll see you next time.
Thank you.
Great, thanks.